Now to our special coverage of the water contamination crisis gripping the town of Oakey. What lurks beneath is taking its toll on residents, not just physically, but mentally. And health professionals say a vacuum of information is now making that situation worse. Lachlan Kennedy is in Oakey. Lachlan, some of the concern is for people who aren't directly affected by the contamination.
Yes, Georgie, a local GP here described it as a sense of hysteria that swept through the community, fuelled by that lack of information, but also by some newspaper headlines that suggested this entire town was toxic. Now, that has upset a lot of people because it's not true. The town water is fine and the vast majority of the 4,200 residents are not affected. But for the people who are living and breathing this struggle every day, whose groundwater and bore water are contaminated, well, it's something that is affecting them deeply. When Jenny Spencer and her husband bought their 5-acre block on the outskirts of Oakey 4 years ago, they had big plans. But now everything is on hold, advised by valuers not to build a home because of a contaminated bore.
I've had people tell me, just get over it, walk away from your land and take it on the chin as a loss. Like, what kind of logic is that?
Her fight with Defence has taken its toll. Life goes on. Tattooed on her arm provides motivation. But she fears others who've pumped every cent they have into their land are dangerously close to giving up.
This is people's lives that we are playing with, that we are dealing with, that Defence is playing with. And as I said before, my worry is that, I'm going to find someone, or we're going to hear of someone hanging in a shed.
Dr John Hall has been a GP in Oakey for a decade. He says a lack of official information about the chemicals and inaccurate media reporting has led to some people suffering significant mental illness.
Diagnosed depressive illnesses and increase in suicidality as well.
Defence now has a community liaison officer connecting residents with government support services. Dr Hall says that's a great step, but more is needed.
What we really need is some significant investment into the town with some ongoing psychology services.
As part of a $55 million commitment, Defence is paying for voluntary blood tests, but their usefulness is under question.
If the blood test isn't going to tell us anything significant about someone's ongoing health, then in my view, it's unnecessary.
While the test will report on a patient's levels of PFOS and PFOA chemicals, toxicologists are still working to discover what that means for human health.
We know at these really high concentrations we see these effects, but at what level do they actually kick in? What's a safe dose? What's a harmful dose?
More questions the residents of Oakey need answered. Dr John Hall educated his own staff last night with a presentation, giving them and telling them what he knew about the chemicals PFOS and PFOA. But really, Georgie, it should be the Federal Health Department that is here educating the 50 or 60 so health staff employed in this town. Now, tomorrow night, live from Oakey, we'll talk about the hit to business, how real estate and retail in this town has been reeling and how really it's not fair.
Thank you, Lachlan, reporting live from Oakey.